The time. Well, let's pick up on this idea that as of today, you can provide a home for a Ukrainian. You register, and then hopefully you can find details, and then you will be funded to the tune of £350 a month. More on that, and also something you've heard on the LBC News Bulletin: young cancer patients are on their way to the UK from Ukraine for life-saving care. Shall we use that, pick up on that story first, and get more details from the Health Secretary, Sajid Javid, who joins me now. What is the number of the children who are coming here? How long will they be here for, Secretary of State? Good morning.
Good morning. The number is, it's 21 very ill Ukrainian children with cancer. They were all receiving treatment in Ukraine before this war started. They've all been forced out of their home country by the Russian invasion, and they will be here for as long as necessary. They're here with their mothers in most cases, one or two carers. I think 49 people in total we airlifted over the weekend, and I'm incredibly grateful to everyone that's helped to do this. It was a very tough operation to get them out from different parts of Ukraine, and particularly grateful to the Polish government and the NHS, and now they're here in the UK. They will be cared for by our incredible NHS staff.
And while that is tremendous news, and as you rightly say, Secretary of State, credit to everyone involved, with a population of around 45 million, there are probably other children in Ukraine who also have cancer. How were they selected, and will others be afforded this opportunity?
We worked with a charity, a cancer charity that's on the ground in Ukraine, and we also worked with our partners around the region. I've mentioned the Poles, but also the Germans and the Spanish have also taken some children in a similar situation, and we offered to take as many that were necessary, that they needed the UK to take, and I'm really pleased that we're able to do that. Of course, we'll continue to work with our partners to see what other support we can provide. I might also add, Nick, also in terms of medical support, we're also working with the Poles on looking at what kind of support we can provide on the front line, immediate medical support for those seeking sanctuary. And my department has, since the war started, already had 8 flights as of this morning. We sent out of medical supplies, vital medicines and medical equipment, and we will continue to support in that way also.
So more children could come who are desperately ill?
More children could come, yes, of course.
Okay. To the scheme to provide housing or homes or accommodation for Ukrainian refugees, again, this doesn't actually fall on your watch, but I've been contacted by a number of people, one of whom was Melissa in Norwich, who's desperate to provide home. But the website isn't working at the moment. She can't get the necessary page that she needs to get to. This might be, of course, because everyone's logging on. Are you aware of this, Secretary of State?
I don't think, as far as I know, I don't think the website has opened just yet. It is opening up later today to register your interest to be a host. Later today, Michael Gove, my colleague, will be making a statement to Parliament setting out a lot more detail.
I see. So listeners need to bide their time. It will be at some point later today it goes live, just to clarify.
Yes, and then later this week, when the charities then start working with the government, start setting out the details of families that would like to be hosted in the UK, then we will be able to, through an online process, match up a host with a potential family. The family can the host can verify they have the space for that family. They can carry out the duties of a host, and then we can quickly get going.
Will any Ukrainian who arrives here, will they be able to work?
Yes. Any Ukrainian that arrives, they and their family will receive what's called the right to remain here in the UK for 3 years. And during that time, they will have access to public services, such as the health service, education, and others, and also the full right to work.
Well, this really is your brief, of course, Secretary of State, because it's highly likely that they will require NHS care, possibly even emotional health care, in that they could be traumatised. You could have weeping children. You could tragically have a mum with her children who is informed that dad hasn't made it and has been killed by Putin's Russians. Are we going to provide additional NHS care, Secretary of State?
We will provide whatever NHS care is necessary, and we've been working on this now for a while in anticipation of this. But you're quite right, Nick, is that these people are coming from a war zone. Many will be traumatized. Many of their dads will not be with them, and support will be required. So we'll be doing everything from basic health checks to supplying vaccines where necessary to mental health support, whatever kind of support is necessary.
And you're confident there is enough mental health support available across the whole of the NHS, Secretary of State?
Look, we know already, Nick, with because of the pandemic, our services in certain areas, mental health is one of them. They are stretched, but we will do whatever it takes to provide the support that is necessary.
I have to ask you this. It seems to be in vogue to ask senior members of the government. Will you be providing a room or a home for a Ukrainian Secretary of State?
I have considered it. I haven't made a decision yet. Obviously, I need to discuss it together with my wife. But I think whoever is a host, they need to make sure that they can offer the time, I think, that is necessary to be a proper host. And I'm not sure personally whether I can do that myself. But even if one cannot be a host, I think there are many ways that anyone can help. That one of the simplest ways actually is, and obviously I've done this like many millions of British people, is to donate to the Disasters Emergency Committee appeal.
Can I move you to other matters? And I can get you any number between 6 and 20. I refer to the number of miles from the Polish border the latest bombing from Putin took place. This obviously, I don't need to remind you, but to remind my listeners, an attack on one member of NATO is an attack on all members of NATO. Secretary of State, how does this escalate the situation in your view?
Well, we've been very clear from the start with our NATO allies that if there is any kind of attack on NATO territory, then it will be war with NATO, and there will be a severe response. We don't ever set out in advance how exactly we would respond. Of course, we'd work together with our allies. But let's be very clear, Nick, that if a single Russian toe cap steps into NATO territory, there will be war with NATO.
There seems to be, from peace talks, a slightly better tone over the weekend than there has been in the preceding days, and I have to say, sadly, the preceding weeks. Are you picking up that possibly Putin, just possibly, is starting to have some degree of rational reason?
Well, look, let's just go by what we know. There are talks, of course, going on, and I think it's always good to talk, and we would all encourage that. At the same time, the atrocities continue. There are despicable attacks this whole weekend. You referred to them on innocent civilians. When it comes to health facilities, for example, the WHO has documented evidence now this weekend of 31 health facilities being targeted by the Russians so far. These are war crimes. So whilst these talks are going on, Russia continues to attack all these innocent civilians. And if they were serious about peace, one of the obvious things to do would be to have an immediate ceasefire and to stop these attacks and continue and focus on the talks.
One of the results of this conflict, sadly, has been the soaring price of oil, which is reflected, of course, at the pumps for your constituents and for my listeners. It wasn't that long ago, Secretary of State, that you were the Chancellor. We hear from your colleague next week. Would you be reviewing the decision concerning national insurance?
Well, as you say, I was Chancellor. One of the benefits of not being the Chancellor at the moment is not having to make these decisions. But look, when it comes to funding the NHS, of course, we need a proper long-term plan in place. That's what the Chancellor has presented, and he has my full support in doing so.
So you wouldn't be reviewing the NI? You wouldn't be, because obviously your department benefits hugely from this.
I think the Chancellor and the Prime Minister, for that matter, they've both been very clear that we need a proper long-term way to fund the NHS, the challenges that we face, and they've set out a plan.
Last couple of questions. On a global perspective, I understand the Prime Minister will be travelling to Saudi Arabia at some point this week to talk about the possible supply of oil. While it is to be welcomed, we don't send money to Putin, of course. Would we want to do deals with the Saudi, noting their human rights record?
We've had a long-standing relationship with the Saudi government where there's always a very frank exchange. We don't agree with their approach on human rights. We're always right to call that out and to talk to them frankly about that. At the same time, it is also possible to have an economic relationship, whether people like it or not. Saudi Arabia is the world's largest producer of crude oil, and it's important, especially at a time of a major global energy crisis, that we have these talks with them. Lastly,
and very much on your brief, you're aware, I'm sure, that lockdowns are starting again. You mentioned China. Lockdowns again are starting in parts of China. Are the considerable concern over, I believe, a new strain of, and as if my listeners haven't got enough to cope with in their lives, a new strain of COVID. A, are you, and I'm sure the British government is aware of that. B, could it prompt any measures here, Secretary of State?
There's no new strain that we have any concerns with. I think what is happening in China on the mainland, in fact, we're also seeing it in Hong Kong, it's Omicron. It's not a new strain, it's Omicron. As many of your listeners will know, that China and Hong Kong have tried to have what they've sort of referred to as a zero COVID policy, and it's clearly not working. Omicron, as we saw in this country, is hugely transmissible, and the best way to protect yourself against it is through vaccination, it's through treatments, it's through testing, and that's exactly what we did. We did it successfully, and that's why we are the most open country in the world.
So you're watching with great vigilance, but there's nothing to give concern to my listeners?
No, not at this point.
All right, grateful as ever for your time. Thank you very much, Sajid Javid, appearing here on LBC, the Health Secretary. 8 o'clock, LBC News is next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom, US officials claim Russia has asked China for military equipment to use in its invasion of Ukraine. Beijing has responded, calling it disinformation put out by the Americans. President Biden's national security advisor, Jake Sullivan, is due to meet his Chinese counterpart in Rome later. He's given a warning to China, speaking to NBC.
They think that they can basically bail Russia out. They can give Russia a workaround to the sanctions that we've imposed. They should have another thing coming, because we will ensure that neither China nor anyone else can compensate Russia for these losses.
Ukraine's President Zelensky has again called on NATO